Today is August 23rd. This is my head to toe assessment. Scanning the room. My table over here, as well as the floor. Okay, all right. I'm gonna begin by washing my hands. Hello, my name is Beth. I'll be taking care of you today. I'm gonna start with the inspection of the skin of the face, head, neck, anterior chest, posterior chest, the upper and lower extremities. I'll be looking for the color, temperature, the any redness or swelling, any lesions, any neva, bruising, or scars. I will also be checking the face and the head. The head is normocephalic. It is midline and symmetric. The hair, I'm going to be checking for the texture, the color, and distribution. It's coarse. It is fine. Be checking for any, and also palpating the skull. Is there any tenderness?
No.
There are no deformities, no masses, no infestations noted. The temporal arteries, be checking those. Does this hurt?
No.
Okay, no tenderness noted. The lymph nodes, we have the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, as well as the supraclavicular. Any tenderness?
No.
Okay. We're going to be checking TMJ for any subluxation or crepitus. Can you open and close your jaw? Okay. And we're also going to be pressing on the masseter muscle. I want you to clench your teeth. Okay, does that hurt?
No.
Okay, and checking for light touch sensation. I want you to close your eyes and let me know when you feel this.
Yes, 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 yes.
Okay, so cranial nerve 5 is intact. Going to be checking the ears. I'm going to be inspecting and palpating the tragus as well as the pinnae. Does that hurt at all?
No.
Okay, so no tenderness noted. They're symmetric bilaterally. Going to look in the auditory canal as well as the tympanic membrane. Okay, there is no erythema noted. The tympanic membrane is pearly gray and it is intact bilaterally. I'm going to be assessing cranial nerve 8 with the whisper test. I'm going to close one ear and I want you to whisper what you hear.
4, 3, 1.
Okay, now the other side.
A, B, 3.
Okay, we're also going to be checking the Weber test for lateralization. I want to let me know if you hear this equally on both sides.
Yes.
Okay, as well as the Ryan test. I want you to let me know when you no longer hear this.
Okay. Okay.
Okay, and the other side.
Okay. Okay.
Okay, so air conduction is greater than bone conduction. Cranial nerve 8 is intact. I'm going to be taking a look at the eyes. Be looking at the eyebrows, the eyelashes, as well as the palpebral fissures. And they are, eyes are symmetric bilaterally. I'm going to be taking a look at the sclera and conjunctiva. Okay. All right, the sclera is white, non-icteric. There are no lesions or exudate noted. I'm going to be checking for pupillary response to light. I want you to look at. Okay, pupils are equally round and reactive to light with both direct and consensual constriction. Want you to, let's go ahead and check cranial nerve 2 for visual acuity. I want you to cover your eye and read the lowest line that you can.
OLGP.
Okay, now cover your other eye and read the lowest line that you can.
DHJBS.
Okay, so left eye is 20/50, right eye is 20/40. And for peripheral vision, I want you to cover your right eye and I want you to look straight at me and tell me how many fingers.
2, 1, 2.
Okay. I'm sorry, now cover the other eye. How many fingers?
2, 1.
Okay, so peripheral and central vision are intact. Cranial nerve 2 is intact. Going to check for accommodation and convergence. I want you to look at my finger. Look at the wall behind me. Now look at my finger. Okay, pupils constrict bilaterally. Now follow my finger. Pupils constrict bilaterally. Want to go ahead and check for cranial nerves 3, 4, and 6 with the extraocular movements. I want you to follow my finger, just your eyes. Okay, cranial nerves 3, 4, and 6 are intact. Pupillary response to light was cranial nerve 3. Okay, want to go ahead and assess. I'm going to be looking at checking for the red reflex as well as the macula, fundus, and optic disc. Okay, the red reflex is intact bilaterally. The fundus and macula are seen. The optic disc margins were sharp and well defined. For the nose, I want you to close one nostril, breathe in. Other side. Okay, so the nose is patent bilaterally. Okay, can you identify the smell for me?
Coffee.
Okay, so cranial nerve 1 is intact. I'm going to be palpating the frontal sinuses for any tenderness. None?
None.
And the maxillary sinuses, any tenderness?
None.
Okay, no tenderness noted. For the mouth, I'm looking at the mouth, the lips. Can you open your mouth for me? The palate, the tongue, the teeth, the buccal mucosa. Can you lift your tongue? The floor of the mouth, the salivary ducts. Can you stick out your tongue? Say ah. Okay, so the soft palate and uvula rise symmetrically. The phonation, cranial nerves 9 and 10 are intact. There are no tonsils present. There was no lesions or exudate seen inside the mouth. The mucosa was pink and moist. I want you to stick out your tongue. Move it side to side. Okay, cranial nerve 12 is intact. I will then be checking for the trachea. I'm going to palpate it. It is symmetrical. I'm going to check for the thyroid. Please make it. I just want you to swallow. Okay, no nodules were felt. I'm going to palpate the carotid arteries. They are 2+ bilaterally. I'm going to auscultate for any bruise with the bell of my stethoscope. Okay, no bruise were heard. And then I'm going to be checking the anterior chest for any signs of respiratory distress. There is no nasal flaring, no retractions, no cyanosis, no tachypnea is seen. The posterior chest is symmetric. I'm going to place my hands here. I want you to take a deep breath in and out. Okay, chest expansion is symmetric bilaterally. There are no deformities seen. The chest is symmetrical. I want to check for tactile firmness. I want you to say 99 when you feel my hands.
99, 99, 99, 99.
Okay, so vibrations were felt equal bilaterally. I'm going to go ahead and take a listen to the lung fields. I want you to take a deep breath in and out when you feel my stethoscope. Also be getting the lateral lung fields, as well as the right middle lobe here, under the axilla. All right, now for consolidation, I'm going to begin with bronchophony. I want you to say 99 when you feel my stethoscope.
99, 99, 99, 99, 99, 99.
Okay, for whisper pectoriloquy, I want you to whisper 99 when you feel my stethoscope.
99, 99, 99, 99, 99, 99.
Okay, and for egophony, I want you to say the letter E when you feel my stethoscope.
E, 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 E.
Okay, there's no evidence of consolidation. The lungs were clear throughout bilaterally. I'm going to percuss over the lung fields. Okay, so resonance was heard throughout. I'm going to check the anterior chest. It is symmetric bilaterally. There are no obvious signs of any deformities. Take a deep breath in and out. Okay, chest expansion is symmetric bilaterally. I'm going to be checking for tactile firmness, say 99.
99, 99, 99.
Okay, vibrations were felt equal bilaterally. Going to be listening to the lung fields. Take a breath in and out. Okay. All right, and we're going to go ahead and check for, I'm going to go ahead and take a listen to the heart with both the bell and diaphragm of my stethoscope. The aortic, pulmonic, herbs, tricuspid, mitral, aortic, pulmonic, herbs, tricuspid, mitral. Okay. S1 and S2 was heard. I'm going to identify and palpate the PMI. Okay, and I'm going to listen for a full minute for the apical pulse. S1, S2 was heard. The rhythm was regular. Rate was 60. I'm going to go ahead and have you lay on back at a 30 to 45 degree angle. I want you to turn your head to the left and to the right. There is no evidence of any JVD. I'm going to be inspecting for any heaves or lifts, and none are seen. I'll be palpating over, or I'll be feeling for any thrills over the auscultation points, the aortic, pulmonic, herbs, tricuspid, and mitral. Okay, and I'm going to listen to the heart again. Aortic, pulmonic, herbs, tricuspid, mitral, aortic, pulmonic, herbs, tricuspid, mitral. Okay, and I'm going to be inspecting the abdomen for symmetry, and it is round and symmetrical. I'm going to listen for any bruise with the bell of my stethoscope, the aorta, the renal arteries, iliac arteries, the femoral arteries. Okay, no bruise were heard. I'm going to listen to bowel sounds in all 4 quadrants. Bowel sounds are normoactive. We're going to be checking for any tenderness and masses. Any tenderness or masses?
No.
Okay. We're also going to be checking for the spleen and the liver. Okay, I want you to take a deep breath in and out. Okay, and for the spleen, deep breath in and out. Okay, they're non-palpable. And we're going to go ahead and have you sit back up again. Okay, and I'm going to check for CVA tenderness. I want you to let me know if this hurts.
No.
Okay.
No.
Okay, no tenderness noted. We're going to begin with the upper extremities. The skin as well is intact. There is no swelling or redness. We've got the inspecting the joints of the hands for symmetry. Any crepitus? Does this hurt? Any tenderness?
No.
Okay. Okay. I'm going to check the cap refill, which is less than 3 seconds. The radial pulses are 2+ bilaterally. And for the range of motion, for the fingers, flexion, extension, hyperextension, abduction, adduction, thumb opposition. Okay. The wrists, flexion, extension, hyperextension, radial deviation, ulnar deviation, rotation. Okay, elbows, flex, extend, and there's no hyperextension. For the shoulders, we have flexion, extension, hyperextension. Okay, and then we've got internal rotation, external rotation, circumduction. Okay, okay, you can have a seat again. Okay, I'm checking grip strength. Squeeze my fingers. Grip strength is 5 out of 5. I'm checking the bicep tricep grip. I want you to push against me here. Pull against me. Yeah, pull again. Push me. Yeah, there you go. Okay, bicep tricep strength 5 out of 5. Push against me here. Pull against me here. Okay. Shoulder strength is 5 out of 5. I want you to shrug against me. Okay. Strength is 5 out of 5. Cranial nerve 11 is intact. And we're going to be checking for cerebellar coordination with finger thumb opposition, hand flip flop. Okay, and I want you to touch your finger, right finger to your nose, now to my finger, now to your nose, now my finger, now with your left finger, my finger, your nose, my finger. Okay, cerebellar coordination is intact. We're going to be checking for stereogenesis. I want you to close your eyes and hold out your right hand. Can you identify this item?
Fingernail file.
Okay, now for the other hand, can you identify this item?
That's a sucker,
Okay.
candy sucker.
Okay, so stereogenesis is intact. I'm going to keep your eyes closed, and I'm going to draw a number on your hand. I want you to tell me what number it is.
4.
Okay, now the other hand.
3.
Okay, that is intact. You can open your eyes now. We'll be checking for light touch sensation. Sorry, go ahead and close your eyes. Let me know when you feel this.
Yes. 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 Yes.
Okay, light touch is intact. We'll be checking for vibratory sensation. Keep your eyes closed. Let me know when you feel this.
Yes.
Okay.
Yes.
Okay.
Yes. Yes.
Okay, vibratory sensation is intact. We're checking our, you can open your eyes now. We'll be checking our deep tendon reflexes, the brachioradialis here. Okay. The biceps. Okay, the triceps. Bilaterally. The patellar. Okay, the Achilles. Okay, and the Babinski. All right. Okay, the reflexes are intact bilaterally. We're going to be checking for our joints, for the feet, the ankles, the knees, and the hips, for any tenderness, swelling, any deformities. They are symmetrical. Any no crepitus or nodules or crepitus. Sorry. As seen, the cap refill on the toes is less than 2 seconds. Dorsalis pedis pulses are 2+ bilaterally, and the posterior tibial pulses are 2+ bilaterally. Okay. For range of motion of the toes, can you flex your toes? Extend, hyperextend. Okay. Can you abduct? Adduct. Okay. For the ankles, we have You can stay seated if you want. It's dorsiflexion. Can you do it with both feet? Okay, dorsiflexion is up, plantar flexion is down. Okay, internal rotation, external, and rotation. Okay. All right, the knees, if you want to stand up. Okay, we have flexion. Can you do both? Okay, extend, they're extended and there's no hyperextension. For the hips, we have flexion, extension, hyperextension. Okay, now we have external rotation, internal rotation. Okay, and circumduction with both of them. Okay, cool. Go ahead and have a seat. We're checking ankle strength. I want you to push against me here. No, push down against me. Okay, ankle strength is 5 out of 5. For the knees, push against me. Okay, pull against me. Okay, it's 5 out of 5. For the hips, push. Okay, hip strength is 5 out of 5. All right, let's go ahead and check for Romberg if you want to stand up. I want you to hold your arms out and close your eyes. Okay, there's no swaying. I want you to check for gait. I want you to go ahead and walk across the room. Now come back, heel to toe. Let's look for the regular and tandem gait. Okay. Now I want you to, that's good. I want you to hop on one foot. Can you hop on the other foot? Okay, and that concludes our head to toe assessment.
Thank you.